As individuals enter into their retirement years, they often find themselves having to navigate the world of Medicare. As a program that is typically for those 65 years and older, it may be a daunting task to learn the ins and outs of. Well, lucky for you, Colin Evans from Evans Financial Group is here to give us a breakdown and an explanation in 4 easy steps. Colin, thank you for being here today.
Thanks so much for having us again.
So what is Medicare and who is eligible to benefit from it?
Well, you know, why we kind of thought this was important is because we're getting ready. We're about 8 weeks out from open enrollment timeframe, which starts in mid-October, October 15th. And that gives the opportunity for those that are involved in Medicare to make changes in plans and things of that nature. And that's an ease of time for them to do it. So with being that we're 8 weeks out, we thought we'd come up with 4 bullet points, kind of simplified, because it is really kind of can be a confusing world. And our first step, Medicaid is, it's really a government health insurance program. This is specifically designed for people typically over age 65.
Okay.
There's a few that are going to fall in and underneath that. That's going to be some people with specific disabilities and things like that that can actually fall and qualify for receiving that care as well. That helpfully offset and allows for some government assistance in that. So in our second bullet point, we kind of have to break down quickly coverage options because there's really 4 basic types, and conveniently they've named them A, B, C, and D. With A being is specifically the hospital side. This is hospital stays and covering things of skilled nursing care and even in some certain circumstances, home health care. When we move over to the B side of things, we're looking at medical insurance that's really like your doctor visits, your preventative maintenance, things like that. It will kind of allow for some home health care as well. Just depends on the parameters of where somebody is. When we start looking into the private side of things, we go into Part C, which is your Medicare Advantage, and this is where private insurance kind of combines a little bit of Part A, which is our hospital side, Part B, which is just your medical and doctor visit side, and they're combining these together and kind of helping package into a plan perspective with insurance companies, but they're also adding stuff in like vision and dental insurance.
So different options in these plans.
Correct, and they start breaking down different options for people. And then we go into Part D, which Part D, a simple rule of thumb is D for drugs. D is the prescription drug plan, and these are typically either going to be funded by the consumer, and they're paying for it. This is an additional insurance program that they're going to pay for, but we're trying to offset those costs and those out-of-pocket costs that can be pretty hefty up front when we start looking at Medicare. Well, when we start moving and we go into like enrollment and costs of that, well, most people are actually already automatically enrolled in the hospitalization part when they turn 65.
So it's automatic at that time?
It is automatic.
Okay.
In most cases, when you turn 65. Now, again, if we're going with somebody with special needs or disabilities, that's going to be a separate enrollment that they were going to have to do on their own. Part B side, which is the your doctor visits, your preventative care, that is something that you do have to enroll in separately. Then when we look at those additional coverages in C and D, when we're looking at some Medigap side and covering those prescription drugs, those are typically handled by private insurance carriers, and those are something that the people have to sign up for themselves or on their own. So when we do that, that really gives some supplemental coverage options because we're really trying to ease the pain. Because there's kind of some statistics that get thrown around, but typically for retirement, we tell people, say, you need to take your salary and you need to multiply it times 3 of your last year, and that's going to be an amount that you need to plan for the rest of your life on spending on health care. I mean, health care is a big expense when you go into the retirement years. So that's why knowing and having access to these type plans can become gigantic.
Wow. Well, thank you so much, Colin, for talking to us about Medicare and breaking that down for us.
Absolutely.
I mean, that's vital information. I didn't even know some of that, as well as how much you're supposed to be budgeting at the end for Medicare.
It can help out, and there's plenty of options that can go out there, and it's just really, we just suggest visiting with a financial professional and one that specializes in Medicare coverage that can really help you out.
Wonderful. Well, thank you for being here today.
Thanks for having us again.